Yeah, hi, Dr. Bakshi. How are you, ma'am?
Doing well, Shyam. Nice to have you again.
Yeah, I have one more question.
Yes.
Now, last time around, you showed me some practices for a blocked nose, and I did them, and it gave great results. Now, I wanted to ask a further question, and that is regarding what I can do to improve my immunity. What breath practices do you have for after opening the nose to improve the immunity and resilience?
Interesting question. Now, you know what it is like in the old days, kingdoms. You remember in India also there were kingdoms, and even in Europe, there are big castles, right?
Yeah.
In the castle, there's a wall, very big walls, tall walls, and then there are the people guards who are sitting there on the castle. And also there is a moat around. Moat is the like a little water area, little ditch, water around. So people, the people, what's his name? The enemies cannot come easily. Now, why am I saying all this? Because virus is our enemy. The virus is our enemy. The enemy should not enter. And when it enters, it needs to get killed. It cannot go past certain level.
Yes.
Even in castle, I mean, there are like layers and layers, right? First layer is the one big wall, and then there's something else, and there are some more guards and all that before they can really get into the castle, into the actual area.
Yeah, a lot of barriers.
Yeah. So, we have the same types of barriers. We just know how to use them. We don't, if our guards are down, like they say, guards are down, guard is down. If the guards are down, now we have a problem. So we need to know exactly how to use them. And so when you say resistance or resilience or immunity, it begins with understanding how the air enters. Now, one of the things that we talk about is cold air and dry air. You remember what we said, when the cold air enters, we feel cold. The nose, face gets cold, the hands gets cold, circulation gets less in the area. Now, if the circulation is less, what happens? There's not enough fighting people coming in there with the immune system and all that doesn't come. So dry, cold air is to be avoided. Now we all know that people talk about, when the summer will be here, heat will be here, the virus will not work. I mean, the only reason why the virus is winning is because we are allowing it to win.
Yeah.
The load is a lot more, and we are allowing it to win. But on the other side of the coin is you have possibility to change that whole system. Supposing the system is such that it is, let's say in the same castle, the wall is there, but there were some spikes there, or there's the spikes in the ground also, there are some spikes. And so water is perfect example. It's moisture, So your moisture is water in moat is an example. So when you have moisture, then the virus also can get caught. And also heat, supposing it was a hot moat,
Yeah.
There will be a problem. Boiling water, or very hot oil. They used to pour oil. I think you remember that part. In some of the medieval fights, you probably remember that. So heat and moisture are important as a barrier in some way.
Okay.
And also it allows the immune system to work all the way to the tip there. So that's number one. Number 2 point is your nose. Now, if you have enough oxygen, like you opened up your nostril, both of them, and enough oxygen with both nice open nostrils, you'll be able to fight better. These guards who are standing there, they need to be fed. They need to make sure that so having enough oxygen through the nose is important. So that's the second step. We already did that one, and you didn't allow alternate entry. Yeah, this entry is like a second gate. Now, in kingdoms, there were some people who will open up the second gate. Those people who are really defecting from the kingdom, they were joining the enemy. Opening the mouth and breathing through the mouth is just like that. Opening the alternate gate, and you get infection in the throat. So I'm just running this parallel because it's kind of interesting how we don't think about these things. So breathe through the nose. Then the next area comes these vestibules, these sinuses. The sinuses are like another guards, Why they are guards? Because they trap the air. Supposing there was a little bit of dirt coming in, something like that. People develop sinusitis because sinus is the first area to catch everything, along with the nose. And there is some irregular, they call it irregular lining of the nose, called turbinate, they call it. But if you ever look at the nose, in the profile, picture of nose, in the profile, you will see these little ridges, the ridges inside the nose, inside wall like that. And when you see that, that is also little turbulent air. So that like mixes it up a little bit. And if you have same, it's a defense mechanism. But the air going in that direction has got warming timing, filtering timing, moisturizing timing. All that is helpful. Now, so when you do this, let's breathe very well. Open your nostril up like this. Smile and breathe. By the way, when you smile, this muscle opens up. For example, this muscle is called Elvis Presley muscle. Elvis Presley used to smile like that. The nostril opens up like that, and so breathe well. Check your nostril again. Inhale and exhale. Make sure they are all open. Then you do is massage. Massage your sinuses. Now, when you massage like that, you bring more blood flow in there. You wake up the guards that are sleeping. Wake them up. Wake them up. Come on. Don't sleep. Enemy can come in anytime, And then tap them. They're sleeping, they tap them. And you can close one nostril and do it, or you can do it both simultaneously. It doesn't matter. Now there are other sinuses here along, so just massage that. All in all, you bring more blood flow. Sinuses is massage. There's another one here. Open that up. Frontal sinus. Massage that. Tap that. And then tap up on the top here. Anytime you tap, there may not be a sinus, but what happens is when you tap, the vibrations of the tapping will go and then knock off a little bit like you experienced last time, It can knock off, then go up here in the temple area. There's a deep sinus called sphenoid sinus. That also knocks it off a little bit. Now breathe. And then relax. This area, angle of jaw. Massage that. Now sinus massage and this jaw relaxes. Jaw masseter, this muscle is very tight. Many times when you're anxious, people have clenching of teeth, they grind the teeth, when they are anxious or all that. So this relaxes that. When the mouth is relaxed, the whole passage becomes open. Check that again. Massage the gum. Face area is a lot of blood flow. Massage the gum. This all brings a lot of blood flow to this area. Now, for example, when we do steam, why do we do steam? It just doesn't go only through the nose, but the rest of the face feels very warm, doesn't it?
Yeah.
And so that's the whole idea of bringing a lot more of guards, like, for example, the blood flow and everything else to this area. And so that trick is one of the first things that you do in the morning, or anytime you want to do nasal massage, opening it up and massage the nose and the sinuses and tapping is extremely beneficial for and against the bacterial and also viral invasion. Okay, so I recommend that practice should be part of the routine. How many times? As many times as you want to do it. As many times you can. Make sure your hands are clean. Don't touch your face with you touch anywhere else. That's different. But make sure you wash your hands before you do your face massage, or you're going to enter the viruses there. Got it?
Yeah, true.
Okay.
Yeah.
All right.
Thank you.
Welcome.